Hello and welcome. Think of this as a conversation, a chance for us to talk about something incredibly important, learning how to recognize the warning signs your body gives you when your heart might be in trouble. So, let's get started. So, let me ask you this right from the start. Is your body trying to tell you something? Our bodies are constantly communicating with us. The real trick, though, is learning how to listen, especially when the message is urgent. So first things first, we have to start by actually listening to our bodies and understanding what these different signals really mean. Now, the official term for this is cardiovascular distress. But what does that actually mean in simple terms? Well, it's when your heart and your entire circulatory system are really struggling to do their most important job, which is to get blood where it needs to go. And this struggle, it's not silent. It creates physical clues, these little red flags that we need to pay attention to. Okay, let's move on to what I call the primary concerns. These are the classic, big-ticket warning signs that tend to be the loudest alarms. There are three main signs we really need to watch for: chest discomfort, shortness of breath, and a really unusual level of fatigue. So let's break down what each of these actually feels like, one by one. First up, chest discomfort. And this is so important. It's not always that sudden, sharp pain you see in the movies. A lot of the time, it's more like a heavy pressure, almost like an elephant is sitting on your chest. Or it could be a squeezing feeling, a general tightness, or even just a weird sense of fullness. Next is shortness of breath. Look, we all get a little winded when we go up a bunch of stairs, right? That's normal. But the red flag here is feeling out of breath when you're just sitting down or after doing something really light, like walking to the kitchen. That's a sign your heart is having to work way too hard just to move oxygen around. And the third classic sign is fatigue. And again, I'm not talking about just feeling tired after a long week. This is a profound exhaustion, a deep, heavy feeling that seems to come out of nowhere. It's the kind of tired that can literally stop you from doing your normal, everyday things. All right, so we've covered the really obvious signs. But sometimes your body whispers instead of shouts. Let's dig into some of the more subtle red flags, which are just as critical, but honestly are much easier to ignore. Things like swelling in your legs, ankles, or feet, or that sudden feeling of dizziness or lightheadedness when you stand up. Maybe you felt your heart fluttering, racing, or even skipping a beat. We call those palpitations. And another big one is pain that starts in the chest but then travels, maybe down your arm or up into your jaw. Even a persistent cough that you just can't shake could be a sign. Don't brush these things off. So you're probably wondering, okay, but what's actually causing all of this? Well, it all comes down to blood flow, and I find a simple analogy really helps make this clear. I want you to imagine your arteries are a highway system. When everything's healthy, the traffic, that's your blood, is flowing perfectly smoothly, delivering oxygen to all its destinations. But if there's a blockage, it's like a 5-car pileup. A huge traffic jam starts. The flow slows to a crawl, and the consequence? Well, all those important destinations, like your brain and your muscles, they aren't getting the fuel they need to function. And that's exactly why you might feel dizzy or exhausted. It's a supply problem. Recognizing the signs is step one, and it's a huge step. But step two is just as important, and that's knowing exactly what to do and when to get help. This is your action plan. Now, this is probably the most important thing we'll discuss. I need you to take this very seriously. If any of these symptoms we've talked about, the big ones or the subtle ones, are severe, if they come on suddenly, or if they just won't go away, you need to seek immediate medical attention. The time for waiting is over. So let me say it one more time to be perfectly clear. Do not dismiss these signs. Don't tell yourself it's just heartburn or that you're just overworked. Your body is sending a critical message, and it demands an urgent response. Acting quickly is absolutely crucial. All right, before we finish, let's talk about the long game. Because being aware of warnings is for emergencies, but long-term heart health is all about what you do every day. So I want to leave you with 3 simple things to focus on. First, aim for a balanced diet, more whole foods, fruits, vegetables. Second, get some regular movement in your day. You'd be amazed what a brisk walk can do. And third, find healthy ways to manage your stress, because believe me, it has a direct impact on your heart. So, you now have the knowledge, you know what to look for, and you know what to do. The power is truly in your hands. So the real question I have for you is this: are you prepared to really listen and to act when your body speaks? Because being proactive is your single greatest asset.